Look at that. See that right there? Just arrived. This is one of the many refrigerator trucks arriving in places like Arizona and Texas, so requested by healthcare officials there because they're literally running out of room to store the bodies of people who have died from COVID-19. What makes this situation worse is that often one community, like in this case, in the case of Texas, El Paso, it gets hit so hard that it simply runs out of beds, runs out of morgue space. In fact, here are the numbers of the El Paso community alone. Behar County is what it's actually called, where officials say that right now, according to the county dashboard that we have verified, by the way, there are more than 26,000 active cases and more than 1,000 people who are hospitalized, and the number is growing. One county. So although it depends, obviously, in which community you live, it is safe to say right now that, according to the latest data, the number of hospitalizations have increased nationwide. For example, the number of Americans hospitalized all at once topped 60,000 this week, and that was for the very first time. So, by all indications, the fall surge that we were told would occur appears to be happening. So, the question now is how soon will there be relief, either in the form of federal dollars, in the form of a vaccine that is actually ready for widespread usage, which is the big difference when it comes to vaccines. Dr. John Dombrowski, one of the best known in the area and always a go-to guy for us, and there he is with that handsome, smiling face. Dr. Dombrowski, thanks so much for joining us. Let's talk, if we can, a little bit. I think a lot of people are sitting at home watching us, not only here in the States, but all over the world, and they're trying to make sense of this situation. On the one hand, we're told that we're going through a surge, and there are all indications that we are. On the other hand, we're told that we're on the brink of having some kind of magical solution for all of this. Split the infinitives here, if you would, Doctor.
So I think we can actually do both. Yes, we are seeing a surge, but we cannot deny the science that we're seeing. Tremendous therapeutics that have come out. We know more about this virus than ever before in terms of the lethality, but more importantly, who is at risk for this? And again, these bodies look terrible, but if you look at the real science and the data, the majority of the people do recover. I know that doesn't make a lot of news. I mean, but that is really important. And I think the thing we have to think about as physicians, and we do this all the time, we triage patients. If you're sick and elderly, you need care and you need to be protected. If you're young and healthy, the likelihood you're going to a hospital overwhelming the medical system is not really that great, because that's what the data shows. Can people get it? Can children get this? Of course. Yes. But they also get influenza as well. So I think we've got this almost panic porn with respect to COVID. It is serious. It is. Don't get me wrong. But if you look at the data in terms of everybody, that's important.